Good morning everyone. Today we are discuss about respiratory system. Respiratory system is the organ system responsible for breathing and gas exchange. Its primary function is to supply oxygen to the body and remove carbon dioxide produced during cellular metabolism. It also helps in speech, smell and maintaining acid-base balance. Respiratory system consists of upper respiratory tract, lower respiratory tract, lungs and respiratory muscles. Upper respiratory tract includes nose and nasal cavity. The nose is the primary entry point for air. Nasal hairs filter dust and foreign particles. The nasal cavity warms, moistens and filters inhaled air. The mucous membrane traps microorganisms and dust. Paranasal sinus. These are air filtered cavity located in the skull. Function: reduce skull weight, add resonance to the voice, warm and humidify inhaled air. Pharynx: the pharynx is the muscular tube about 12 to 14 cm long. It is divided into nasopharynx located behind the nasal cavity, oropharynx located behind the oral cavity, laryngopharynx connects the larynx and esophagus. Functions: passage for air and food. Lower respiratory tract, larynx, voice box located between the pharynx and trachea, contain vocal cord, produce sound during speech. Epiglottis, a flap of cartilage, prevent food from entering the airway during swallowing. Trachea, windpipe, approximately 10 to 12 cm long, supported by a C-shaped cartilaginous ring, conduct air to from the lungs. Trachea divides into right primary bronchus and left primary bronchus. Bronchi enter the lungs and divide into smaller branches: primary bronchi, secondary bronchi, tertiary bronchi and bronchioles. Function of bronchi: conduct air throughout the lungs. Bronchioles, small air passage without cartilaginous smooth muscle, regulate airflow, lead to alveolar duct and alveolar sac. Lungs are paired spongy organ located into the thoracic cavity. Right lung has three lobes: superior lobe, middle lobe, inferior lobe. Left lung has two lobes: superior lobe, inferior lobe. The left lung is smaller because it accommodates the heart. Pleura. Each lung is covered by a double layered membrane called the pleura. Visceral pleura covers the lungs. Parietal pleura lines the chest cavity. Pleural fluid reduce friction during breathing. Alveoli are a tiny air sac, the functional unit of the lungs. Characteristics: about 300 million alveoli are present in both lungs. Walls are only 1 cell thick, surrounded by capillaries. Function of alveoli: sites of gas exchange, oxygen diffuses into blood, carbon dioxide diffuses from blood into alveoli. Mechanism of breathing: consists of inspiration, inhalation. During inspiration, diaphragm contracts and moves downward. External intercostal muscles contract. Thoracic cavity volume increase. Lung pressure decrease. Air enters the lungs. Exhalation. During expiration, diaphragm relax. Thoracic cavity volume decrease. Lung pressure increase. Air is expelled from the lungs. Gas exchange occurs in the alveoli. Oxygen transport: oxygen enters pulmonary capillary, binds with hemoglobin in red blood cells. Transport to body tissue. Carbon dioxide transport produced by cellular metabolism, transported through blood to lungs, exhaled during breathing. Regulation of respiration. Breathing is controlled by the respiratory centers in the brain. Medulla oblongata, main respiratory center, control rhythm of breathing. Pons regulates rate and depth of breathing. chemoreceptor monitor carbon dioxide level, oxygen level, blood pH. An increase in carbon dioxide stimulates faster breathing. Function of respiratory system: provide oxygen to the body, removes carbon dioxide, maintain acid-base balance, produce speech through vocal cords, enable sense of smell, filter warmth and humidify air, protect against microorganisms and foreign particles. Common respiratory disorder: asthma, pneumonia, tuberculosis, chronic obstructive pulmonary disease, COVID-19. The respiratory system consists of upper and lower respiratory tract, lungs, alveoli, and respiratory muscles. It is responsible for oxygen supply, carbon dioxide removal, maintenance of acid-base balance, speech, and olfaction. The lungs and alveoli serves as the primary site of gas exchange, making the respiratory system essential for life.